Constipation is another common lower GI disease. There are subjective definitions and then the definition that medical professionals use to reach a formal diagnosis. For the subjective definition, patients often complain of at least one, if not more, or all of these signs and symptoms. So decreased in the frequency of bowel movement, presence of hard stools, or the patient is straining and they need to try really hard to have a bowel movement. Any of these would fit the subjective definition. And if we look at these, they come more in the form of a chief complaint. So it's what the patient is telling us, what is going on with them. They can be kind of difficult to quantify. So in order for healthcare professionals to reach a medical diagnosis, the Rome 3 consensus criteria, these were developed. So the textbook lists the criteria in detail, so please make sure to study this. I believe it's on page 396 of your book. The etiology of constipation is the opposite of diarrhea in many cases. So we have the colonic transit time is decreased, and we know that in the case of diarrhea, it's increased. The colon pushes out the feces too frequently, but in constipation, this is the opposite. So slowed transit time. It could also be a rectal outlet obstruction caused by either fecal matter staying in place, or adhesions, or even a tumor. So if we think about it, if there was a colorectal cancer that was blocking the lumen, then the passage of the feces would be consistently delayed or even blocked. We also have pelvic floor dysfunction. So we know our rectum is in the pelvis, and in the pelvis area we have different tissues and different muscles. The work of these muscles is under different regulations. So for example, if there's a malfunction, then the different movements of the muscle may become compromised, and this would result in compromised defecation. Also, irritable bowel syndrome, or IBS. We will discuss this in more detail later, but know that IBS could lead to diarrhea or constipation or both. So this is a condition that has some very unpleasant symptoms associated with it. Certain medical conditions also can cause constipation. For example, multiple sclerosis or Parkinson's disease can cause it. Also, some medications can have the side effects of constipation. For example, a lot of painkillers such as morphine, and also other types of medications such as antidiuretics and antihistamines. So we know that histamines are chemicals involved in allergic reactions. When we talked about the immune function, we mentioned mast cells are involved with the allergic response and that they secrete histamine to mediate the reaction. And this causes those itchy symptoms that we can get. So people may take antihistamines to reduce their allergy symptoms so they won't be as itchy, but it can cause constipation, and some of the antihistamines, especially kind of the first generation antihistamines, can also cause drowsiness. So something to keep in mind. Also, there are side effects from some supplements. So things like iron supplements and calcium supplements can lead to constipation, especially when they're provided in large amounts. So patients often report that their fecal matter is hard or has a pellic-like appearance, and also that they have abdominal pain, bloating, and gas. So we mentioned that to reach the medical diagnosis, in addition to the patient's chief complaint, we need to follow this Rome 3 consensus criteria. We also need to do a complete history and physical exams, including lab work that has complete blood cell count and hormone levels, among with other labs. And because rectal obstruction could be a reason for people having constipation, we would also want to do an endoscope to check for the presence of a tumor. Now, if the passage is just being blocked by fecal matter, that's one thing, but we definitely want to look into it and make sure that it is not being blocked by a tumor. So treating the underlying disease is always the best approach. Also for constipation, we could retrain the bowel movement. But if we think about it, we really don't have the ability to control our bowel movements 100%, so this course of treatment could be limited. And under bowel training, we need to mention patients with diabetes. So we know that a long-term complication of diabetes is neuropathy, and this could be more than just altered sense at the fingertips or in the bottom of the foot. It can also alter nerves that regulate bowel movements. So many long-term diabetic patients, especially when they become elderly, have constipation. And this is partially because the nerves that regulate their bowel movement have become damaged by long-term hyperglycemia. So in this case, it would be pretty difficult to completely resolve the constipation because it's resulting from nerve damage due to the diabetes. So it's important that we make sure that these patients realize this so they don't have unrealistic expectations. And then we can also use temporary fixes by adding more moisture or other agents to the rectum or colon. We can decrease friction so that the patient doesn't suffer as much while trying to defecate. And we can also use fiber, such as a bulking agent, or use a stool softener to change the consistency and texture of the stool. So this will allow the patient to excrete it more easily. The nutrition assessment is, the usual. We need to check intakes, especially fluid, beverage, and dietary fiber intake. So all of these add volume and affect the moisture of the stool, and this could, make a difference. Also, we know that certain supplements are known to cause constipation, so we would want to check that history as well. And we definitely need to be checking medication use here. So nutrition diagnosis usually includes inadequate intake of fluid or fiber or both. And I think altered GI function is pretty obvious here, and we can also have undesirable food choices. For nutrition intervention, we want to increase intake of whole grains, fruits, and vegetables. This would help us increase the fiber intake since fiber comes from these plant-based foods. Thus, all of the food groups that we want to promote here are plant-based. For fiber, we want to intake 25 to 35 grams per day. And if we look at the basic recommendation, this is maybe slightly higher than the recommendation based on a 2,000 calorie diet. So we know that fiber amount is based on grams per 1,000 calorie intake, and 25 to 35 is kind of on the higher end of that recommendation for adults. For fluid intake, at least 2 liters per day. And also, for the healthy colon environment, the profile of the healthy colon bacteria is really important. Therefore, the use of prebiotics and probiotics are indicated in constipation as well, kind of same as we did with diarrhea. So please look in your book. It has a very good table that lists the commercially available products in this category, and please do take time to review it. So fiber intake is the focus of nutrition therapy for constipation. Here are some tips on how to give high fiber nutrition therapy. So the tips are very straightforward. Please just remember that fiber can only come from plants. Therefore, when we want to increase fiber intake, we will be increasing whole grain products, fruits, and vegetables. So these tips are very useful for clients. They'll be asking you what they should be eating, and this is pretty straightforward here. So it would definitely be handy to have for a nutrition education session.